from traditional folk remedies to modern Western medicine. In both Indonesia and Japan, this transformation was shaped by Dutch medicine. The stage is Jakarta, the Museum of National Awakening, where the building that gave birth to modern medicine still stands. And the iMuseum, located within the current medical university, which teaches the mechanisms of life. This is part of the Indonesia Museum series. This time, we trace the history of modern medicine in both countries.
Let me share what I learned from the two museums in Jakarta.
Curiosity connects us all. If you love discovering real culture, please subscribe this channel. The era of folk medicine, wisdom against illness. Before there were formal systems to heal sickness or injury, people relied on traditional means. Japanese physicians of Kampo medicine, shrine maidens, midwives, and masseur have long supported people's health and lives. People sought healing in hot springs, prayed for recovery at temples and shrines, and traded herbal remedies born in local regions. Folk wisdom passed down through generations was deeply rooted in everyday life.
So they couldn't cure everything, but they still tried their best to heal people in their own way.
Meanwhile, in Indonesia, spiritual healers called dukun played an important role. They not only prayed but also assisted in childbirth and circumcision, performed massage, and practiced herbal medicine, serving their communities with specialized knowledge. Traditional herbal treatments, such as the drink jamu and the ointment parem, made from natural ingredients, have a long history and remain a part of daily life today.
So a spiritual healer could also be a masseur or a pharmacist. That's amazing. Jamu sounds like medicine, but it actually sounds kind of tasty.
The Netherlands, gateway of Western medicine. In the 19th century, the traditional forms of medicine began to slowly change. Behind this transformation was a common keyword: the Netherlands. In 1823, a Dutch trading post physician named Philip Frans van Siebold arrived in Japan. He was a man of great vision, dedicated to shaping Japan's future through knowledge. In Nagasaki, the only place in Japan permitted to trade with the West at the time, Siebold founded a private school called Narutaki Juku, where he taught Western medicine to Japanese students. Those students later became doctors and scholars who led the modernization of Japan's medical system.
It sounds like Narutaki Juku wasn't just a school. More like a modern-day medical seminar, right?
Meanwhile, in Indonesia, in 1830, under Dutch colonial rule, the Netherlands began the cultivation system, designed to raise funds for wars in Europe. It required large-scale cultivation of sugarcane and other crops for export, generating profit for the colonial government. At first, the policy seemed successful, boosting regional economies and increasing population. However, since farmlands were diverted from food production to export crops, famine and disease soon became widespread. The outbreak of smallpox, which even infected infants, was devastating. To respond to this crisis, a Dutch physician named Willem Bosch proposed the establishment of the Dr. Jawa School, a program to train Indonesians as doctors. This school would later be renamed STOVIA and become the foundation of modern Indonesian medicine.
I saw a photo of a baby with smallpox at the iMuseum. It was heartbreaking. There was even a video of a baby smoking. I guess people back then didn't really understand what health meant yet.
The beginning of modern medical education. In the latter half of the 19th century, Western medicine evolved from the pursuit of dedicated individuals into an organized system that supported society. During this era, medicine transformed from something to be learned into something to be nurtured. In Japan, the Meiji government established a modern medical system in 1874, known as the Issei. Becoming a doctor now required government approval, and medical schools were founded across the country. Regulations for handling medicine and licensing systems were also introduced, marking the true beginning of modern medical practice.
So this is when the government really got serious about developing Japan's healthcare and training doctors. Feels like the sound of a new era.
Meanwhile, in Indonesia, in 1902, the Dr. Jawa School was renamed STOVIA, beginning a new chapter in medical education. Today, STOVIA stands as the Museum of National Awakening. The Indonesian students trained there gained qualifications as doctors. But after graduation, they were required to serve in remote or rural areas under harsh conditions. Although their treatment and salaries were far from favorable, they traveled to places where healthcare had yet to reach, taking on the vital role of improving community health in Indonesia, a task that Dutch doctors had been unable to accomplish.
Becoming a doctor back then really took courage. I can really feel how much they wanted to save their people.
War and Reconstruction. As time moved forward and medicine began to take shape as a national system, a great war broke out, cutting off that progress. In Japan during the 1930s, medicine came to be treated as part of the military supply system that supported the war effort. It became integrated with the machinery of the military and national mobilization. Doctors and nurses were sent to battlefields, while in the cities, air raids and shortages of supplies left hospitals and medicines in critically short supply. After the war, under American guidance, Japan began reforming its medical system. And in 1961, the nation introduced universal health insurance, a system that allowed every citizen to receive medical care. It marked the beginning of an era when everyone could visit hospitals with peace of mind.
It's amazing. Even poor people could get treatment. Such a wonderful system.
Meanwhile, in Indonesia, the medical school, which had developed from STOVIA, was closed in 1942 under Japanese occupation. It was renamed in Japanese as Jakarta Ika Daigaku and Ika Daigaku Byoen, and medicine itself became part of Japan's occupation policy. After Japan's defeat, the Dutch attempted to regain control, and in 1946 they established a temporary university. This institution would later become the forerunner of the modern University of Indonesia, the very same university where the iMuseum now stands.
Wait! They even changed the university's name into Japanese? So spreading Japanese culture was part of the occupation policy too.
The development of public health, protecting lives from home. As time went on, medicine was no longer something reserved for specialists. It evolved into a social system, one that everyone could support and be protected by. In post-war Japan, tuberculosis became a serious social problem. Under government leadership, nationwide health checkups and vaccination programs were implemented. Schools also promoted health guidance and hygiene education, teaching children to wash their hands and gargle. The knowledge they learned at school was brought back home and shared with their families. Then came the COVID-19 pandemic in 2019. Simple measures such as wearing masks and washing hands helped save countless lives.
I remember when I was a kid, my parents always told me to wash my hands and gargle after coming home from school.
Meanwhile, in Indonesia, after gaining independence, the country adopted an American-style medical education system, and its national universities were gradually consolidated. Community health centers called puskesmas were established across the nation, providing programs in maternal and child health, malaria, tuberculosis, and vaccinations. Public health-oriented medicine spread nationwide as a central government policy. However, during the COVID-19 pandemic, the country's large population and other factors led to one of the highest numbers of casualties in the region. Today, Indonesia is placing great emphasis on hygiene education in schools and museums.
The iMuseum had a really strong focus on hygiene education. There was even a display warning people not to leave water standing. It said that's how mosquitoes that spread dengue fever start to breed.
Throughout history, medicine has not only been about science and technology, it has also sought to answer one question: how we value human life. At the iMuseum in Jakarta, Indonesia, exhibits teach children about hygiene and sex education in fun and engaging ways, while medical students and adults can study human organ specimens to gain a deeper understanding of how life works.
They even have exhibits about sex education. Life isn't just about the body. The heart matters too.
The young students who once studied at STOVIA grew not only in medical knowledge, but also in their sense of duty. The belief that they could heal their nation. Many of them became leaders in Indonesia's long struggle for independence. That spirit continues to this day. The Faculty of Medicine at the Modern University of Indonesia, together with the iMuseum, keeps supporting the health of future generations through both education and medicine.
Medicine is really the study of how to protect the future. I'm so glad I came here. Thank you for watching.
Curiosity connects us all. If you love discovering real culture, please subscribe this channel.